Hi, this is Dr. Jim Edwards with the Bedford Chiropractic Center. I'm here today. We're going to talk for just a couple of minutes about whiplash and some of the common misconceptions about it, and then more importantly, what can be some of the long-term results if it's not treated properly. What is whiplash? Whiplash is when the neck gets thrown backwards and forwards, usually as a result of an auto accident and typically as a result of being struck from behind. But that causes injuries to the muscles in the neck. It causes injuries to the small spinal joints, and as well as, more importantly, it causes injuries to the nerves. And if we look here at this picture on this chart, we can also see from the side view, we see the normal position and normal curvature of the neck, and then we see as a result of trauma, the neck becomes straightened out, the curve is lost, and that causes more compression or more pressure on the spinal vertebra and on the spinal disc, and it causes a narrowing of this disc space, which then causes a compression or an irritation of the spinal nerves. So other things is, people ask, if there's not any damage to the car, is there any chance that I still might be injured? And the answer to that is absolutely yes. You can't equate damage to the car with whether you have an injury or not. Now, a lot of insurance companies will try to tell you, well, you can't possibly be injured because your car has no damage. But because of the way cars are designed now, particularly with the bumper systems, the energy doesn't cause car damage, but it causes occupant damage. So that's definitely something that you want to keep in mind. The other is, the most common symptom or sign, first sign of any type of a whiplash is some type of soreness or stiffness, typically of the neck. But also 50% of the time the lower back is also injured as well. So either neck or lower back, you ought to get in and get it checked out. And then the other is, what happens if I don't get this treated? Are there any possible problems with that? Because honestly, many times patients will go to the emergency room, and sometimes the doctor or the nurses in the emergency room say, well, it's just going to be sore for a few days, but it'll be okay. And that is not true, because the untreated whiplash can cause long-term consequences. So I'm going to show you a couple of x-rays that are just pretty vivid and show what we're talking about here. Get rid of this chart. First of all, this is a normal x-ray of the neck, and I'll point out a couple of things, but one thing in particular is that we have a normal, smooth, C-shaped curve, which you can see here. If we also look closely, we can see that there's an even amount of spacing between the vertebra and the discs, and there's no compression or no arthritis along the spinal joint. So this is a nice, normal neck. Everyone should hope to have one like that. This next x-ray is actually an x-ray that shows the results of an untreated whiplash. And if you compare, you can see that this curve is actually reversed compared to this curve. And if we look closely, we see that the spinal discs are very narrow, much like a fried or squished egg or a squashed donut. And now we also have the formation of bone spurs on the front portion of the vertebra and also on the back portion of the vertebra right next to where the nerves exit. So this is the long-term consequence of an untreated whiplash that probably started with just some minor soreness. The person thought, well, if the soreness goes away, the problem is fixed. But the soreness is the first sign of the misalignment that eventually leads to this. So if you've been in an auto accident, or if you know anybody that has been, make sure that you get them in and get them checked out. This is Jim Edwards, Bedford Chiropractic Center. Thanks very much.